Hello everyone. International Women's Day 2024 is a day that commemorates the extraordinary contributions of women in all spheres of life, whether it's within the confines of their homes or in the bustling corridors of offices. International Women's Day serves as a symbolic culmination of both the public and private struggles endured by women. It's a day when we honor the relentless fight for women's rights and the everyday battles fought by women everywhere. This year, the United Nations has bestowed upon us a powerful theme: count her in, invest in women, accelerate progress. This theme encapsulates the essence of inclusivity and progress, reminding us that when we invest in women, we invest in a brighter, more equitable future for all. When we reflect on the journey of women's rights, we see how far we have come and yet how far we still have to go. International Women's Day is not just a celebration, it's a call to action, especially to accelerate gender parity and to ensure that every woman, regardless of nationality, ethnicity, language, culture, economic status, or political affiliation, is recognized and valued for her achievements. The roots of International Women's Day trace back to February 28, 1909, when the first observance took place in the United States. It was a day dedicated to honoring the courageous women who protested against deplorable working conditions during a strike in 1908. Since then, this day has evolved into a global movement, transcending borders and uniting women from all walks of life. So let's celebrate the bravery of everyday women who have made a lasting impact and encourage everyone to appreciate and include women, thus creating a world where every woman feels valued and empowered because when women rise, humanity rises.
Okay, thank you so much, Dr. Indrani Paul, for that introduction. That was a great introduction. And I'd just like to introduce our organization, Maternal Infant Health Canada. So Maternal Infant Health Canada, or MIHCan for short, is a global public health organization that is composed of public health professionals, doctors, researchers, and integrative health practitioners who work to improve the lives of women and children within Canada and around the world. We aim to work closely with local healthcare workers and traditional medicine providers, government and community members to improve maternal and infant health and also reduce maternal and infant mortality. The organization was founded and is led by Dr. Farah Shroff, who is a faculty member at the University of British Columbia and a Takami Fellow from the Harvard School of Public Health.
Thank you so much, Amanat. So our guest for today's event is the Honorable Dr. Asha Seth. She's a family practice OBGYN with 45 years of practice and the first Indo-Canadian female to be appointed to the Senate of Canada. In this role, she's adopted humanitarian causes such as maternal, newborn, and child health and the welfare of disabled people. In the Senate of Canada, Senator Seth also sat on many committees, including but not limited to the Standing Senate Committee of Aboriginal Affairs, Social Affairs, Science and Technology, National Finance, and Standing Committee on Internal Economy, Budgets, and Administration. Senator Seth was part of Canada's longest ever trade mission to India. She earned her medical degree from India and was instrumental in organizing a blood donation clinic in service of the Indian Army during the Sino-Indian conflict. Upon her arrival in Canada in 1971, Dr. Seth finished her resident training in OBGYN from Toronto. Philanthropy has been a mainstay in essence of her work. She's the founder of the Canadian Foundation for Health and Human Welfare, National Board Director for CNIB, and founding president of NIMDAC Foundation, chair of fundraising for the Heart and Stroke Foundation, member of the Board of Governors of the Canada India Foundation. Dr. Seth retired from the Senate in 2014 but she continues to represent Canada's international development priorities. She also actively promotes recognition and education of her Senate motions in support of National Vision Health Month and International Maternal and Newborn Health Month, both in Canada and internationally. Dr. Seth serves on the national board of the Canadian National Institute for the Blind and is a representative of the Micronutrient Initiative. Dr. Seth is the recipient of numerous accolades and honors, some of them being recipient of the Canadian Immigrants People's Choice Award as one of the top 25 Canadian immigrants, the 30 most influential Indo-Canadians Power List, ICICI Bank NRI of the Year Award, and a Lifetime Achievement Award from the Dancing Damsels in 2016. The Honorable Asha Seth's unabated passion for mother, child health, and vision health is her mission. Her journey continues. Although we don't have Dr. Seth join us live for the event today, we are thrilled to welcome her virtually as she shares her insightful pre-recorded video pertaining to her work and women's health with our audience. Thank you.
Hello everyone, happy International Women's Day. I would like to thank to Dr. Farah Sharaf for this honor, opportunity to speak here. Once again, thank you, Farah. Once again, it's a very special day. Happy International Women's Day. Today, the significance of the celebration is strong moms and empowered women is very meaningful. It signifies life and womanhood. The International Women's Day 2024 campaign theme is Inspire Inclusion. When we inspire others to understand and value women's inclusion, we forge a better world. And women themselves are inspired to be included. Then there is a sense of belonging, relevance, and empowerment. I was born in India. Women remained one framed by four walls, the walls of domesticity. Yet the first stone has been cast, and women were not willing to be chained to the kitchen. So, my story is one of opening doors one by one until I found myself in a place I never could have expected at the beginning of my journey. I was blessed, just like you are, to find the support of my family. After medical school in India, I moved to UK, where I trained at various prestigious hospitals, and then I moved to Canada in October month in the shivering cold weather in Winnipeg. So, start opening those doors just like I did. And you will be surprised where the journey takes you. As a woman who pursued her career as a physician, delivered thousands of babies, and helped bring life into the world, heard the first cry of the baby and laughter of the family. What an incredible experience. As a professional woman and a mother, I have faced the challenges to balance career, volunteerism, and family responsibility. But the aspiration to make a positive difference in the life of others is what has always driven my medical career, my community involvement, and my charitable initiatives. Being an international trained medical doctor, I had to finish entrance exam, many more to get a license to practice. But the support and trust of my community and family is what gave me the strength to push towards the obstacle of being a young mother, a newcomer, entrepreneur, and a philanthropist. So I was really thrilled. In 2011, I was humbled to receive the Council Award from the College of Physician and Surgeon of Ontario. The award is a celebratory recognition given to physicians who have sustained a record of excellence and come closest to meeting society's vision of an ideal physician. But I think the trust and admiration of the country may be crystallized in my appointment to the Senate of Canada, where I became the first Indo-Canadian female to be appointed in the Senate of Canada. But I have been very passionate and advocate about marginalized, underprivileged, disability-related causes locally and internationally. In this role, I succeeded in bringing new attention to the causes such as maternal, newborn, and child health mortality around the world by millions of people. In the Senate of Canada, I also sat many committees and traveled India 3 times on behalf of the Government of Canada. So including in 2012 for Canada's longest ever trade mission to India with Prime Minister in 2013. Again, I traveled with a trade mission and met with Prime Minister Modi, to whom I delivered greetings on behalf of the Government of Canada. I also organized, or I was very thrilled, organized and executed the first ever mission to take place between Canada and UP. Great. I continued to engage high-level stakeholders in India with the goal of expanding academic, cultural, and commercial exchange. Then, May 1st, 2014, I had an honor to launch the first ever National Vision Health Month with the unanimous support of my colleagues. A united Senate joined me in campaign to recognize May as a month to educate Canadians about their vision health and help eliminate avoidable sight loss across the country. So in 2014 again, my friends, I proudly created the government-endorsed International Maternal, Newborn and Child Health Week to campaign an important platform in the efforts to decrease maternal and childhood mortality. I also again traveled India in 2017 to advocate for better health and nutrition globally for women and children. So I visited New Delhi, Lucknow, where I visited the offices and program of Nutrition International. So during this visit, I spoke to a group of medical peers at the All India Indian Institute for the Medical Sciences in Delhi, where I again reinforced the importance of improving nutrition. But the most important, memorable day of my trip was to visit a small place or a small village called Hasnapur in UP. I visited an Anganwadi center supported by Nutrition International at the center. I was given an opportunity to interact with the pregnant women, mothers to the young children, adolescents, girls, and community health workers. I spoke with aggregated social health service activists. I also spoke to trained female community health volunteers about their work and daily challenges they face. Now, I would like to talk about my recent work related with children's vision health. The fact is, a Canadian loses their sight every 12 minutes. It was an eye opener and led me to support this noble cause. My mission is to safeguard our children's future through the vision of gift of vision. So in collaboration with CNIB, which is called Canadian National Institute for the Blind, I pledged to raise awareness about the critical importance of eye examination starting at 6 month age of 6 months, then 2 years after continuing annually throughout a child's education journey. Our children's eyes are windows to their learning experience. You will be surprised to know with 80% of information absorbed visually. To empower parents, educators, and stakeholders, I commit to create awareness campaigns in school, ensuring that eye health become a cornerstone of early education. So my advice has been to all young women aspiring politicians. Education gave me a great base in my life. A base to be a physician, to be a community leader, to be an advocate, even to be a senator. So your education is your passport. Leave that behind, you won't go very far. With your education in hand, you must pack up your determination and perseverance. You will find bumps and obstacles on the road. Some are so big, you will think the road has ended and disappeared. And when this happens, you cannot stop. I can't tell you how many times I have turned a dead end into a new path. Be a trailblazer. Take the road less traveled. Never take no for an answer, and that will make the biggest difference. To young women, my advice: you can achieve your dreams if you work hard, be persistent, and believe in yourself. You will succeed. With success and along your journey, it is also important to give back. I'd like to, at this point, to conclude by thanking you once again for giving me this opportunity. But before I leave, I like to quote In the words of famous Pablo Picasso, the meaning of life is to find your gift. The meaning of life is to find your gift, and the purpose of life is to give it away. Thank you. Thank you very much for listening me. I hope I didn't bore you. Once again, happy International Women's Day. Thank you. Bye.
Okay, thank you so much, Dr. Seth, for that video and participating in this event. We greatly, greatly appreciate it and the wise words that you have shared. All right, so we're going to move on and we're going to share some poetry by some powerful poetry by women scholars and poets related to women's admiration for one another, resilience, and empowerment. So we are going to start off with you, Dr. Nazia. You will be reading the first poem.
Thank you so much, Amanat. So I will be reading a poem by Dr. Farah Shroff, and it's called Jaan, which essentially means life. So this poem comes with a short intro, the main poem, and a little conclusion. So the poem goes like this. This poem was actually written by Dr. Farah Shroff for her grandmother, just for the context. Okay. So my grandmother, now 95, and I play a fun game, twinkling eyes, dancing hands, giving, receiving, love for love. Granny, tu mari kaleji che. I am her kidney, inside her, so vital. Farah, tu maru beju che. She is my brain, teaching truths. Granny, tumhari dil che. I am her heart, beating life. Granny and me, back and forth, when all the organs have been named. Tumhari jaan che. You are my life, my essence, the breath that makes me who I am. A vibrant song resonating deep in my soul. To honor the women in Dr. Farah Shroff's life, she has written this. She has explained this actually. In Gujarati, expressing love is like saying, you are so important to me that I can't live without you, just like I can't live without my kidneys. The ultimate form of devotion is to declare that our beloved is the essence of life itself, our soul, Jaan. Farah writes, Kumi is my grandmother's first name. Maruk is my mother's first name, and Shroff is my father's last name. When I was quite young, I decided to change my middle names to honor the wonderful women who raised me along with my amazing father. Thank you so much.
Thank you so much, Dr. Nazia. I will continue this on. So I will be reading a poem called You Are More Than Beautiful by Rupi Kaur. So I will start reading it. I want to apologize to all the women I have called beautiful. Before, I've called them intelligent or brave. I'm sorry I made it sound as though something as simple as what you were born with is all you have to be proud of. When you have broken mountains with your wit. From now on, I will say things like, you are resilient, or you are extraordinary, not because I don't think you're beautiful, but because I need you to know you are more than that. Okay, thanks for listening, everyone. And Dr. Indrani Paul, I'll let you take it on from here.
Thank you, Amanat Gill. Now I will recite a poem named Fire by Nikita Gill. Remember what you must do when they undervalue you, when they think your softness is your weakness, when they treat your kindness like it is their advantage. You awaken every dragon, every wolf, every monster that sleeps inside you, and you remind them what hell looks like when it wears the skin of a gentle human.
Thank you so much, Dr. Paul.
So now we will conduct a roundtable discussion among the MIHCan team members. We'll ask a few questions to each other regarding their education and experience. First, I will ask Amanat, who is an MSc student at a Canadian university. So, Amanat, I know your MSc research has a large focus on women's health. Do you think you could expand more on that?
Yeah, absolutely. Thank you so much for your question. So, just to give a general overview of what my MSc topic is about, it is looking to just examine the changes in the use of different services related to HIV prevention, support, and treatment for women sex workers in Nairobi, Kenya during different times of the COVID-19 pandemic. So, as I am sure most of us are aware about, the COVID-19 pandemic has had a huge impact on pretty much every sector, including health services. And in Kenya, women sex workers are considered a key population, which means they are at a disproportionate risk for HIV due to structural factors like stigma and marginalization. And this can also make their access to health services difficult. And as the current literature indicates, the COVID-19 pandemic has introduced even more barriers to their access to health services. During COVID-19, one of the measures or restrictions was that Kenya had a night curfew. So this limited sex workers' availability to working only during the day, which means that it limited their time to seeking health services like HIV health services. And there's also other restrictions to consider. So for one, physical distancing guidelines reduce the capacity of patient volumes within clinics. And the COVID-19 pandemic, as identified in lots of literature, has been linked to increases in gender-based violence and social stigma towards the sex work community. And many HIV health programs also offer violence support services. And as I mentioned, because of COVID, there's even more barriers with accessing HIV health services. So I'm currently, what I'm trying to do with my thesis is I'm looking at the trends in visits for HIV treatment, prevention, and support services offered by a group of clinics based in Nairobi, Kenya, during different times of the pandemic. And this is occurring throughout a 4-year time period from 2019 to 2023. So that's pretty much the gist or the overview of my topic. Thank you for that question.
Thank you, Amanat. And I have another question to you. What do you think are the potential solutions toward health inequities faced by women sex workers during COVID-19 and the policy implications of your research?
Yeah, that's a great question. Thank you so much. I do want to start off by saying that I want to note the resilience that is the resiliency that sex workers have exemplified when it comes to coping with barriers, accessing health services, overcoming marginalization and stigma, and also coping with financial hardships. And current literature shows that much of the sex work community has supported each other financially, emotionally, and also with sharing health education resources. And also indicated in the current literature is that during COVID-19, sex workers around the world have been advocating for their rights with accessing national protection, income support, and healthcare. So they were also establishing their own initiatives like developing guides for working during COVID and setting up emergency funds to provide income support for the sex work community. And to answer your question about the potential policy implications with my project, I think resiliency is also something that's being looked at from the health service perspective or the health systems perspective. Since I'm looking at the service use trends at the clinic level for a group of clinics based in Nairobi, this enables me to see if they're still equipped to run during times of unprecedented stresses that are introduced to the health system, like COVID-19. And that allows for the potential policy structuring to prepare them for future shocks to the health system, like future pandemics, epidemics, or any other public health shocks. And I think it's also really critical to engage the women's sex work community when it comes to improving future programming with these clinics. It's definitely significant to empower their voices and inputs when conceptualizing and improving future HIV programming and understanding any of the current programmatic gaps from their perspective when serving this community during times of unprecedented stress, especially.
Thank you, Amanat, for your valuable insights.
Okay, thank you so much, Dr. Indrani, for all those questions you asked me. And I'm going to move on, and I will be asking Dr. Nazia a couple of questions. So, just to provide some context, Dr. Nazia is a physician from India with 3 years of corporate hospital experience and over 3 years of independent practice. So, Dr. Nazia, if you're ready, I'm going to go ahead and ask you the first question I have for you, which is, what are the diseases or health conditions that you commonly encounter during your private practice?
Okay, so there are a few cases that we encounter almost on a daily basis, even when I was practicing in hospital and even during my private practice. High blood pressure, that is hypertension, diabetes, thyroid disorders. Uh, Diabetes, unfortunately, India is known as the diabetes capital of the world. So more than 80 million people are suffering from diabetes. So these are the three cases that I would see almost always, like on a daily basis, you know. Other health conditions would be tuberculosis. It's a national problem in India. Apart from these, the part of the country where I'm coming from in India, it's Calcutta. It's the eastern part of India. And my state is an endemic area for malaria and dengue. So during peak seasons, we see the hospitals flooded with patients of malaria and dengue. These are some of the major problems that we see every day.
Okay, thank you so much. And my second question for you is, what do you think are the current healthcare challenges people are facing in India? And what do you think what do you think are the solutions?
I think India has come quite a long way in the past few decades. Like, for example, the disease incidence, it has decreased. Infant mortality rate, under 5 mortality rate has decreased. But even though the rate is declining, we are still far behind compared to the global scenario. So we still have a long way to go there. But some other good things are that tetanus and polio have been completely eradicated from the country. So we still have a lot of work to do. One of the challenges that I see currently as a physician from India, I would say, is access to quality healthcare. Almost 80% of the population of India lives in rural areas. So these are the people who have absolutely no access to healthcare. So they have to travel long distances, which increases the cost of treatment, right? So because all the doctors want to settle in urban areas, which is just 20% of the population, basically, the the marginalized section, the poor people, are the ones who are suffering. So if one person gets sick in the family, they are like trapped in that poverty, which they can never probably come out of. So poor access to healthcare would be definitely number one problem that I'm seeing currently. Number two is the healthcare costs in India is pretty high. One of the India is one of the countries which has like the highest amount being paid in healthcare out of pocket. So considering that India is already has the majority of the population is rural population, the poor population, it becomes even more difficult for them to like have access to healthcare because of the cost. So affordability and accessibility, these are the two things. I have personally seen a lot of patients, and I'm not just saying like one or two patients, like many patients who have had to sell all their lands, their properties, all their assets. I remember there was this case. This girl she was I think 13 or 14 years old, and she was suffering from cancer. And her father came and told me, "Doctor, I have sold everything I had. The only property that is left with us is the house that we are staying in." So that's a very sad situation, you know, because people are doing that to get access to good healthcare, and it shouldn't be that difficult. Another thing is, if you look at the ratio of doctors versus patients, we have like 7 doctors for 10,000 population. Compare this to the global average, which is 14 for 10,000 people. So almost double the number of doctors for the same amount of population. So that causes a lot of burden on the doctors who are already practicing. So these are the few healthcare challenges. And regarding the solutions, Of course, this has to be an interdisciplinary approach. The government has to work with doctors have to work with engineers. It has to be like a combined effort from the entire society, I would say. So the first thing I would suggest is that the government has to increase its budget for healthcare allocation. They have to allocate a higher budget for healthcare, for disease prevention, for health promotion, to raise awareness. Spend a small percentage of its GDP on healthcare. So that has to increase. That's number one. What the government can also do is it can incentivize new doctors, for them to move to rural areas. Give them incentives, probably give them accommodation or reduce their tuition fees. So they have like some incentive to move to rural areas and provide care over there. What else? The good thing is that more than 1 billion people in India, they have access to cell phones. So we can leverage that technology. We can use cell phones to educate people, to raise awareness. If there's an outbreak, probably they can just use their cell phone to communicate with the government. So these are the things I think are potential solutions in the near future.
Okay, thank you so much. And I do have one last question for you. So I am aware that you have conducted a workshop in India on mental health. So what I wanted to know is, what do you think is the current status of Indian women with regard to their mental health?
Yes, thank you so much. So last time when I visited India, I did conduct this workshop with an NGO, and the reason why I did that was I am coming from an Indian background and from a Muslim community. So I have seen a lot of stigma in Indians generally, but even more so within the Muslim community. For them, mental disorders do not exist. So if you are having issues with your mental health, you're probably not praying enough. You're probably not spiritual enough. So my main aim of conducting that workshop was, we invited over 50 women along with their children. They came. We also had a parenting session. They came along, and I was so surprised when I saw that so many women, after the workshop ended, they actually came and thanked me. They said that because you are a Muslim doctor from India, you understand what's happening to us, because every time we try to seek help, people were just asking us to pray more, to be more spiritual. So the good thing is that mental health awareness is increasing in India and globally, but people still have that stigma, to discuss mental health challenges. Yeah, that's it.
Thank you so much for your responses, Dr. Nazia. They were very, very insightful.
Thank you so much. I will be asking a few questions to Dr. Indrani. Dr. Indrani is a physician from Bangladesh, and she also has her master's in public health from Bangladesh. So, Dr. Indrani, what do you think, since I was talking about mental health challenges, what do you think is your perspective on this? Like, what kind of unique mental health challenges do women particularly face during various stages of their life?
Thank you, Dr. Najia, for your valuable question. Actually, I also facing that women face different type of challenges, especially the mental health challenges at different stages of their lives during practicing. In adolescence, they may grapple with issues like body image and self-esteem. And when they become pregnant, and especially on the postpartum period, they may experience mood disorder like depression, anxiety, and the one of the most important time is menopause. That is postmenopausal period that can bring hormonal changes and that cause mood swing, insomnia, and that also affects their family life also. And aging. Aging may bring loneliness, grief, or cognitive decline, impacting mental well being. And at that time, they usually feel very helpless and they need support from their family, from their near and dear ones.
So, With cases like maternal mortality and cervical cancer, what do you think? What kind of approach do you think we can implement to prevent these problems?
I believe that to prevent health issues like maternal mortality and cervical cancer in women, we can focus on education. It's very essential for all of the women of our country and of our world, and especially on the access to healthcare and regular screenings. In our country, we think that in case of regular screening, participants usually face different types of problems and they usually don't interested in this. And programs providing prenatal care, skilled birth attendants, and emergency obstetric services can reduce maternal deaths. And for cervical cancer, vaccination against HPV, that is human papilloma virus, regular pap smear test, and early treatment, I think, can prevent its occurrence or catch it early for effective treatment. And I also believe that promoting awareness and providing resources for these interventions are crucial for success in this field.
Okay, thank you so much. Speaking of education and awareness, how do you think education helps women like succeed in life? How do you think it opens ways for, like new opportunities for women? How does education play a role in that?
Thank you, Dr. Nadia. See, there is no doubt that education plays a crucial role in advancing women's rights and opportunities worldwide. When women are educated, they gain knowledge, skills, and confidence to pursue their goals. Education actually empowers women to make informed decisions about their lives, health, and their future. It helps to make a good future planning. It also helps to break down barriers and stereotypes, different types of stigma, and opening the doors to better job opportunities and economic independence that is very essential for every woman in the world.
Right.
And even educated women are more likely to participate in their communities and advocate for their rights, leading to positive social change. So I should say education is a powerful tool for promoting gender equity and unlocking the full potential of women and girls globally. Thank you, Dr. Najia, for
Thank
your
you so much
questions.
for your valuable input. Thank you so much.
That concludes our International Women's Day event. I want to first thank Dr. Asha Seth for her time and sharing her invaluable insights and experiences. I want to thank MIHCan's founder and leader, Dr. Farah Shroff, for facilitating this event. And I would also like to thank all MIHCan team members, including you, Dr. Indrani, and you, Dr. Nazia, for helping plan and participating in this event. And I am very confident we can all continue to celebrate the empowerment, bravery, and resilience of women every day.
Thank you so much, Amanat.
Thank you so much, Amanat.
Thank you.